On this Monday night, the risk of the coronavirus spreading through the air. The warning from hundreds of scientists.
This really had been downplayed.
About mounting evidence of airborne exposure in indoor spaces with poor ventilation. Border screening under scrutiny. Why have tens of thousands of foreigners been allowed into Canada during the pandemic? Beijing's travel advisory, the warning to Chinese citizens about coming to Canada. And a soulful Canadian talent silenced.
This world's gone crazy.
COVID-19 claims a beloved and young Broadway star.
Global National with Donna Friesen.
Good evening and thanks for joining us. We begin with a hot topic among experts in infectious disease and air quality, the airborne transmission of the novel coronavirus. 239 scientists from 32 countries have signed a paper saying we appeal to the medical community and to the relevant national and international bodies to recognize the potential for airborne spread of COVID-19. The concern is about microscopic droplets that linger in the air and can travel further than 2 meters and could be infectious, especially in enclosed spaces with poor ventilation. Crystal Goomansingh on the evolving evidence of airborne transmission.
The virus that causes COVID-19 travels in microscopic droplets, and a large number of scientists around the world want more attention put on those very tiny particles that can stay circulating in a room.
There's a lot of evidence that suggests that airborne transmission can be part of the mechanism involved, and that this really had been downplayed.
The director of the Southern Ontario Centre for Atmospheric Aerosol Research is one of more than 200 experts calling on the World Health Organization to acknowledge the issue and advocate for better air quality systems. Dr. Michael Gardam remains concerned about transmission, even if requirements for better air filtration systems were mandated.
Bars and restaurants are perfect scenarios for that. They're loud. You're right up close with somebody yelling in their face. You may be half drunk, so you're not paying attention to what you're doing. All of that makes it highly likely that this could spread. If you were to increase the ventilation to deal with airborne, that's not going to deal with that face-to-face.
That face-to-face close exchange is believed to be how the majority of infections occur. That's why people are told to keep their distance, wear masks, and to wash their hands. But the authors of this article are putting pressure on the WHO, saying more needs to be done. The WHO responded saying, "We are aware of the article and are reviewing its contents with our technical experts." As more people head out and back to work, Greg Evans wants them to be aware of their environment.
How much of the breath is what we call rebreath or exhaled breath in the room? So what is the potential for exposure to occur if there is somebody who's infected in that space?
The scientists concerned about aerosol transmission say it's not about creating fear, but about giving the public all of the information. Crystal Goomansingh, Global News, London.
It is well established the novel coronavirus can spread through large droplets expelled when an infected person coughs, sneezes, speaks, or sings. They can spread it up to 2 meters or more, depending on their size. That's why we have the 2-meter physical distancing rule and why we encourage wearing masks when that's not possible. This latest research says microdroplets are a potential risk, too. They're just 5 microns in size. A single grain of table salt is about 100 microns. Microdroplets or aerosols can remain aloft longer and spread further. Diseases like measles, chickenpox, and tuberculosis can be spread through airborne transmission. And the experts behind this latest research admit the evidence for all the steps in COVID-19 microdroplet transmission is incomplete, but they do say simple measures like good ventilation, fresh air circulation, and avoiding overcrowding are precautions worth taking. Well, there are lots of things we still don't fully understand about COVID-19, and now there are fresh questions about the origins of the virus. It's widely believed the virus first emerged in China in late 2019 after jumping from animals to humans. Now, an epidemiologist at Oxford University says there's evidence the virus may have been dormant around the world long before the first confirmed case. That theory is based in large part on evidence from Italy, Brazil, and Spain that found traces of the virus in wastewater samples as early as March 2019, 9 months before it emerged in China. The Oxford scientist says experts investigated COVID-19's origins should consider that it may have lain dormant around the world and emerged when the environmental conditions were right for it to thrive. The United States is on track to shatter another COVID-19 record as infections there surge across the country. Nearly 3 million Americans have now tested positive for COVID-19, and that number is ticking up at an alarming rate. According to Reuters, 16 states broke records for new cases in the first 5 days of July. In Florida, more than 10,000 people tested positive yesterday alone. Officials in Miami are now reimposing some restrictions, though as Jackson Proskow reports, many Americans still aren't grasping where this could be headed.
This is exactly what health experts feared. Packed beaches and parties over the 4th of July weekend as COVID-19 cases surge in the majority of states.
Right now, the virus has the upper hand throughout much of America, most of America.
Defiance now seems to be the only national strategy in the U.S. In Florida, which set several daily records for new cases over the weekend, the governor insisted everything is fine because most of the thousands of newly infected are young.
If you're under 40 and you don't have significant comorbidities, the fatality rate for this is pretty close to zero.
That echoes a weekend claim from President Donald Trump.
We show cases, 99% of which are totally harmless.
Who has alternated between ignoring the virus and suggesting Americans should just live with it, to the dismay of those who've already suffered the worst of it.
And now the country is suffering because of the president. And it's time for him to change course. It's time for the president to actually tell the truth.
The U.S. has the highest number of total cases, deaths, and daily new infections of any country on Earth, and has still not reached a consensus on measures like masks and physical distancing.
I think the world is looking at us as a leader in COVID-19.
The White House continues to argue there's only one indicator that matters, the death rate. It's down from its peak. That likely won't last. Hospitals are already overwhelmed in a growing number of states.
Getting used to surges in hospitalizations and deaths is not something that any of us could really get used to. And nor should we really try to get used to this.
In a sign of where it may all be headed, Miami has decided to roll back on reopening as cases there surge, shutting restaurants, gyms, and clubs for a second time. Jackson Proskow, Global News, Washington.
India is rising in the ranks as one of the worst-hit countries in the world. Today, it surpassed Russia, becoming the country with the third most cases after the U.S. and Brazil. More than 24,000 people have tested positive in 24 hours, bringing India's total to nearly 700,000. A temporary hospital with capacity for 10,000 patients is now open in New Delhi to help deal with the surge in cases. In Australia, authorities are taking extreme measures after an outbreak in the Melbourne area. As of Tuesday night, the borders between the country's two most populous states, Victoria and New South Wales, will be closed, and soldiers will be posted along state lines to prevent anyone crossing. The last time this happened was 100 years ago, during the Spanish flu pandemic. Canada's greatest threat from COVID-19 is south of the border. We're sealed off from the alarming spike in cases in the U.S., but only as long as the U.S.-Canada border remains closed to all but essential travel. That agreement is set to expire July 21st. And today, Prime Minister Justin Trudeau says he is not traveling to the U.S. He's just turned down an invitation to visit the White House on Wednesday. Our Ottawa Bureau Chief Mercedes Stephenson joins me. Mercedes, bring us up to speed.
Donna, Prime Minister Justin Trudeau will not be attending that summit in Washington, D.C., despite lingering concerns about potential aluminum tariffs for Canada. Instead, Justin Trudeau will remain here for cabinet meetings and a rare sitting of Parliament, not to mention that much-anticipated fiscal snapshot. But senior government sources did acknowledge concerns about COVID-19, and a potential 14-day quarantine upon his return also played a role in the decision not to go. The border is a concern not only for the Prime Minister, but for many Canadians as they watch COVID-19 cases surging in the United States. And while the border has been closed since March 21st, international air travel has doubled over the last 2 months. The number of passengers arriving from the U.S. and other global destinations has increased from 15,000 people a week in April to 30,000 a week in June. Since May 25th alone, 135,000 air travelers have arrived in Canada. 66,000 of those travelers are not Canadian permanent residents or Canadian citizens. So what are those 66,000 people doing in Canada? The Canada Border Services Agency couldn't give Global News a breakdown, but said all 66,000 are considered exempted foreign nationals, which includes essential workers like medical workers and temporary foreign workers here to labor on farms. But one infection control expert at the University of Toronto finds it hard to believe that that sudden spike is all essential workers and wants a clearer definition.
I think it's really important that we have a national conversation about what essential travel really is.
The concern isn't just about Americans and international travelers who come here, it's also about Canadians who come home but ignore self-isolation rules.
Clearly, some people who say that they will be self-isolating but aren't, and they are putting all of us at risk, and this is not acceptable.
Dr. Colin Furness warns that the closed border may be the new normal for as much as a year, warning that the warm summer weather has given many a false sense of security.
Getting away with a lot, but when September comes and the weather starts to cool down and people start to move inside more, maybe a little bit less vigilant after a few months with very little community spread, we might really be facing a catastrophe.
Donna, according to Health Canada, contact with a traveler accounts for only 1% of Canadian COVID-19 cases. And on top of that, international air travel, even with the recent spike, is still down by about 95% from where it was at this time last year. But there is still pressure to reopen the border. Nearly 30 congressmen and congresswomen signed a letter to the Trump administration advocating for an end to the constant 30-day extensions of the border closure and saying it's time for a phased plan for reopening. Donna?
Mercedes Stephenson in Ottawa, thank you. Prince Edward Island was until Saturday COVID-19 free for more than 2 months. It now has 5 active cases, all of them connected to a man who traveled to Nova Scotia.
One of these cases, a young man traveled to Nova Scotia and spent time with another man in his 20s who had recently arrived from the United States. This new cluster of cases is a strong reminder that we are still susceptible to COVID-19 and that we cannot become complacent.
She says 10 close contacts of those new cases have all tested negative and are now in isolation for 14 days, but that screening at the PEI border will remain in place for the foreseeable future. Clearview AI, the US-based company behind controversial facial recognition software, says it's pulling out of Canada and will no longer work with the RCMP, the company's last remaining client in this country. The technology has been labeled invasive, and Canadian regulators are investigating whether Clearview's artificial intelligence technology breaks privacy laws. Clearview AI came under fire earlier this year after a number of police services in Canada confirmed they had used the technology, which cross-references images of people against billions of photos taken from the internet without consent. There are new details tonight on the intruder who rammed his truck into the gates of Rideau Hall in Ottawa. Court documents reveal the man charged with 22 offenses after breaching the grounds of the residence of both the Prime Minister and the Governor General is accused of uttering a threat or conveying a threat to cause death or bodily harm to Prime Minister Trudeau. According to information sworn by an RCMP officer, he also had loaded firearms with him. The court documents reveal Canadian Forces member Corey Huron, a reservist in the Canadian Rangers, had an M14 rifle, which is prohibited in Canada, though he did have a license for it. He also had 2 shotguns and an unregistered revolver. It's alleged he got out of his vehicle and was heading for Trudeau's residence when he was intercepted and eventually arrested by police. In New York City, a woman who called the police claiming a black man was threatening her in Central Park has now been charged with filing a false report.
Please don't come close to me. Please call the cops.
In May, Amy Cooper drew widespread condemnation after this video went viral. It shows her calling 911 to report she's being threatened by an African-American man. His name is Christian Cooper, and he was bird watching in the park. He simply asked her to put her dog on a leash, as is required in that area. He didn't threaten her, but did record her rant and posted it on social media. She lost her job after this and temporarily had to give up her dog. Tensions between Beijing and Ottawa escalate. Coming up, why China is telling its citizens, don't go to Canada. The UK is imposing sanctions on some of the individuals and organizations behind some of the worst human rights abuses in modern times. They include people from Russia, Saudi Arabia, Myanmar, and North Korea. They'll have their UK assets frozen and are banned from entering the country.
To those who abuse their power to inflict unimaginable suffering, we will not look the other way. You cannot set foot in this country, and we'll seize your blood-drenched, ill-gotten gains if you try.
Some of those affected are senior Saudi intelligence officials accused of being involved in the killing of journalist Jamal Khashoggi in Istanbul, and Russian authorities implicated in the death of Sergei Magnitsky, a lawyer who died in a Moscow prison after exposing a tax fraud scheme involving Russian officials. The British sanctions framework follows the 2012 U.S. Magnitsky Act. China is now warning its citizens to exercise caution when traveling to Canada. Today, a spokesperson for China's foreign ministry said Canada has seriously violated international law and basic norms governing international relations and grossly interfered in China's internal affairs. And it warns Chinese citizens in Canada could be subject to what it calls frequent violent actions from law enforcement. Still ahead, pre-game problems, why sports are still struggling to restart in the pandemic. Plenty of sports fans are waiting for the games to begin again while keeping the players and their families safe. Tonight, some Toronto Blue Jays players who were in close contact with the player who tested positive for COVID-19 are stuck in Florida. And as Eric Sorensen reports, the NHL is making a final pitch on how to get back on the ice safely.
This really will be home to the Toronto Blue Jays. The team will practice and live right here for now, staying at the Marriott Hotel attached to the Rogers Centre baseball field, a giant bubble to keep out COVID-19. The players flew back to Toronto Sunday night.
Found it quite exciting that they are going to reopen. And
fans are looking forward to baseball. The club was training in Dunedin, Florida, till the spread of the virus forced several teams to close down operations. Many ball clubs are now practicing at home, but also isolating from the outside world. Outside of Florida, Toronto could be a major North American hub for sports this summer. If the Blue Jays play their games at home here, it means other major league teams will come to Toronto. And then there's hockey. Toronto could be a hub for 12 NHL playoff teams, all having to isolate or bubble in this city. That would bring Sidney Crosby and other Eastern Conference stars to Toronto. 12 Western teams could play in Edmonton. The League and Players Association have now agreed on protocols that will be voted on this week. Some people aren't thrilled so many sports teams could come to Toronto. One tweeted, "There is zero reason that sports should be putting a single Torontonian at risk." Others aren't so worried.
It'll be good to have the boys home. We love the Jays. We want to see them here. We want to see them safe, healthy.
Health officials say teams will be separated from the public.
As long as bubbles are maintained, one for hockey and one for the baseball players, then the risk to the public is minimal, if anything.
Still, a cloud of uncertainty hangs over pro sports. Major League Soccer's opening match this Wednesday between Vancouver and Dallas was postponed when 6 Dallas players tested positive. The NBA is going ahead with its massive bubble in Disney World. Teams are expected in Orlando this week. The protocols are extensive, says this former Toronto Raptor.
It becomes so frustrating and overwhelming at times because you just never thought you'll be in a situation such as something like this.
With COVID-19 lurking, major sports leagues are taking tentative steps towards a hurry-up start to their seasons. Eric Sorensen, Global News, Toronto.
Up next, a Canadian Broadway star dies of COVID-19. Soundtracks like this from the film The Mission made composer Ennio Morricone legendary. The maestro, as he was known, was 91 years old. He broke his femur 10 days ago and died this morning in a Rome hospital. Morricone created music that set the mood for dozens of big movies, from spaghetti westerns like The Good, the Bad, and the Ugly and Quentin Tarantino's The Hateful Eight, for which he won an Oscar. Well, there's no soundtrack for this next story, though it's a tragedy worthy of lots of attention, and it's a cautionary tale. A Canadian actor, a Broadway star, and a father of a one-year-old son has died of complications from the coronavirus. Nick Cordero was sick for months, much of that spent in a coma, his lungs ravaged by the disease. Mike Drolet on Cordero's life and death.
Every day at 3 p.m., Nick Cordero's wife would sing his song, laughing and dancing with their son Elvis before returning to the hospital to hold the Broadway star's hand. Doctors told Amanda Clute 4 times her husband wouldn't make it, and for 95 days he bucked the odds.
You just feel like you're in this momentum of going around and around and around like a hamster wheel, and I just want to get us out of the hamster wheel.
He had a leg amputated, a pacemaker implanted. He even woke from a coma. But doctors couldn't repair the damage COVID-19 did to his lungs. And no amount of Broadway magic could help the 41-year-old either.
Behind the scenes, we are just, we're just devastated, and our hearts are broken. Our hearts are broken.
Cordero honed his baritone voice in his hometown of Hamilton, Ontario. It's where he learned to love the stage. But it wasn't long before he needed more.
He was one of the very few of us that actually took the leap and went for it and made it.
After all, the way to do is do just as you please.
He starred in Bullets Over Broadway, and while he was nominated for a Tony, he won the affection of his castmate and future wife Amanda. But no matter how Broadway his life became, he always had time for Hamilton.
Nick is Nick, and Nick will always be Nick. And people just loved it. I mean, it was great because he would come home and he would have stories to tell people. And you know, all of us theater kids, all looking up to him, being like, oh my God, what's it like? And, you know, where we all want to be. He was there and he did it.
Yeah, he did it. And when the curtain once again rises on Broadway after the pandemic that took his life is over, no doubt the lights will dim for him too. Mike Drolet, Global News, Toronto.
And that's Global National for this Monday. I'm Donna Friesen. Tonight's Air Canada is Dildo, Newfoundland and Labrador. Been there, got the t-shirt. Thanks for watching.